Hello, I'm Dr. David Byers, Program Director for Dental Hygiene at Lanier Technical College. I want to welcome you to our wonderful new campus that we have here in Hall County. And today, I especially want to showcase the Dental Hygiene Clinic just for you. Let's start out with the reception area. Come this way. Here we have Kim Duncan running the front desk. She greets her patients, schedules the appointments, and overall ensures that everything continues to run smoothly. Yes, we do provide hygiene care to the public. If you're interested in becoming a patient or you'd like to know more about the services we offer, you can find all of that information on our website, or you can simply call Kim. Now, I can't wait to show you our clinic. It is fantastic. Come this way with me. I have several hygiene students lined up to help show us around. As we come into the clinic, you're going to see that we have 15 operatories where we provide patient care. Our goal is to help students learn to become successful dental hygienists. One of the ways that we do this is we like to train them with different types of technology that they're likely to see when they go into private practice. One example for this would be ultrasonic instrumentation. It's going to make it easier and more efficient when they're cleaning teeth. A second example would be the use of the intraoral camera. This greatly facilitates the process when you're providing patient education or when you're treatment planning. Now here we have Mary. Mary is one of our hygiene students. What can you share with us about the clinic today?
It's brand new and it's really clean, and we are so fortunate to have such a wonderful clinic so that we can learn our hygiene skills. All of our services are centered around hygiene, so we are providing exams, x-rays, cleanings, and other preventative procedures. It all depends on what you need. We make a treatment plan that is specific for each patient, and it will be discussed with you in detail before treatment is provided. We are an educational program, so the appointments will run longer than what you are used to seeing at your usual dental clinic, but you can rest assured that each step is carefully monitored by covering faculty, and you will finish up with a thorough cleaning.
Thank you, Mary. That was very helpful. Now, I believe I can hear Cessia running some instruments and sterilization. Let's go that way next. Hey, Cessia, can you share with us a process that you're following to ensure that we have clean dental instruments?
Of course, Dr. Byers. Here we have our sterilization area, which we like to keep as organized as possible. Notice the color coding from red to blue. The red area is for instruments that are dirty, while the blue area is for instruments that have been properly cleaned and sterilized. We like to use this method to ensure that everything is in its proper place. Also notice the foot pedals along the floor. These allow us to open and close some of our cabinetry and use our water system. We also have a built-in sensor, which allows us to open and close our dryer. The advantage here is that we are limiting the amount of surfaces we touch with our hands. We follow a specific process as well to ensure that our instruments are cleaned and sterilized properly. This way they are safe and ready for patient care. This method also helps protect others, including myself, who clean and sterilize the instruments.
Thank you, Cessia. That was very good and very informative. Now, the next stop on the tour, radiology. Come this way. Here we have Donna getting ready to take a digital pan to help with the screening exam. Donna, can you pause for a minute and share with us about the radiology area?
Sure, Dr. Byers. This is our digital pan that we use to help screen patients on their first visit to our clinic. It's a great way to get an initial assessment as to whether they have certain dental needs and if our students are ready to meet that required level of care. We have 4 other operatories that we utilize for x-rays, and we do this by placing either film or a digital sensor inside the mouth. And that's what most patients are probably used to. It really is amazing the amount of detail that we can see from the x-rays that we take, which is awesome because the more that we can see, the better the treatment plan we can develop for our patients.
Excellent. Thank you so much, Donna. We're going next to the dental simulation lab. The final stop on our tour is the dental sim lab, and it is fantastic. In here, you're going to see students honing their skills and perfecting their techniques. I'm going to ask Rachel to share with us what happens in here.
Sure, Dr. Byers. This is the sim lab, and it's one of my favorite areas. We have 16 operatories with mannequins set up, so we can almost exactly simulate real-life patient care. The instructors use this area to teach students the techniques and skills required to use a sharp dental instrument in a safe and precise manner. They insist that we have to show this before we can begin care on a real patient. It's a great way to build confidence, and it's amazing how similar it is to treating a real patient.
Thank you, Rachel. As you can see, we have a wonderful new facility, and we have terrific students that are graduating as dental hygienists ready to go out and serve in the community. We're really excited about the educational opportunities that we have ahead of us, not just with dental hygiene, but with all of Lanier Technical College. And we want to invite you to come join in the fun.